Hello and welcome to Single Payer Radio. I'm Paul Hoppy, broadcasting from the Hayburn Building in Louisville on the WFMP 106.5 Forward Radio Community Network. Our programs air every Monday at 2 p.m., Tuesday at 7 a.m., and Wednesday at 11 a.m. And we also stream our show on SoundCloud. The show is a project of Kentuckians for Single Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. We produce this program because we believe healthcare is a human right. We advocate for a national, not-for-profit, publicly funded, single-payer healthcare system that works for everyone. The views and opinions expressed on our show are those of the speakers and not the station. Our station relies on volunteers like myself and your ideas and donations to keep us on the air. Today, I'm joined by Kay Tillow and Hariette Seiler with my Kentuckians for Single-Payer Healthcare group in a discussion on the possibility of drastic cuts to Medicare and Medicaid. Our chairperson, Kay, will lead us in the discussion. Kay?
Thank you, Paul. Glad to be with you and Hariette today. We're going to be discussing three different articles that are of interest right now as we're battling to protect our health care that we have and to try to move the nation forward to the health care that we need. The first article is one by Maureen Kasich, who writes in the American Prospect. And her article is entitled "The DOGE Czar's Plan to Loot Medicare." And of course, the DOGE czar is the Department of Government Efficiency. That's Elon Musk and his extracurricular department that has been set up. And the second article is by John Canham Klein, who discusses the media coverage of healthcare. And the third is an article in Healthcare Dive, which relates to the projected cuts in Medicaid and all of healthcare that are expected in this current session that we're going through. So let me just begin by giving you a bit of a summary of Maureen Kasich's article about the DOGE czar's plan to loot Medicare. Basically, she asserts that behind Elon Musk is Brad Smith, that he indeed is the person in charge of doing the cuts in healthcare inside of this Department of Government Efficiency. And I'm sure most people don't know who Brad Smith is. He is a healthcare entrepreneur who's made billions off of for-profit healthcare. And he was appointed in the earlier administration to lead the Committee for Medicare and Medicaid Innovation inside the government body that was experimenting in value-based healthcare. And Brad Smith is indeed led that department and must have some major role in this cutting that is going on. Her assertion in the article is that Brad Smith intends to set up something like the Center for Medicare and Medicaid Innovation to replace the vast cuts that he is making. And she goes into the extent to which that department wasted $10 billion over 10 years without any advances in quality or in cutting of costs, and virtually acted instead as a privatizing mechanism to turn over Medicare to venture capital and to private equity under the pretense that it was setting up models of care that would be better for us. So that's her contention, is that this privatization of Medicare and of all of healthcare is behind and underneath all of these cuts by the Department of Government Efficiency. And so that's Brad Smith and her article, in which she goes into some detail about the extent to which that department actually, that CMMI, gave waivers to companies so that they did not have to obey the law. They're called waivers for fraud and abuse. So it's ironic that this department that's supposed to be doing away with the fraud and abuse is being led by someone who gave waivers out so that companies didn't have to go by the law and could do kickbacks and all of those sort of things in the meantime. So,
okay, can I interrupt for a minute? This
sure,
is Hariette. This is Hariette Seiler. When was that article written, and when was he doing all that stuff? This Brad Smith, and is he still there manipulating things behind the scene?
Well, the article was written in February of this year. Brad Smith is currently on the DOGE team. If you look at those listings of the people who are on the DOGE team, Brad Smith is right there. And so he is currently a part of the group that's going in and cutting out, firing, etc., coming up with the plans to cut down on these government bodies.
Well, and again, I'm sorry to interrupt, but I'm kind of familiar from the news, and here in Kentucky, we're familiar and afraid of Medicaid cuts. And I have heard that they want to cut reimbursements to doctors in Medicare. But I'm just not familiar until sort of seeing this article that already they're planning to go into Medicare.
Well, that's what Brad Smith was doing at CMMI, and Maureen Kasich is asserting that that is the plan, that he is the one who is behind the plans for what will happen in healthcare as we go through these DOGE cuts. We don't have the details, it's not very transparent. They fire people, and then some of them, they get pushed back, so they hire them back. And, we have a terrible situation where it's really unknown how bad it's going to be. They're projecting something like 80,000 layoffs in the Veterans Administration, and that's about 15% of their workforce. That will be a terrible, terrible impact on the ability to give care to veterans.
Well, right. When we were kind of discussing it before we came on the air, Paul, what was it you said about they have to go after Medicare?
Well, the huge amount that they have to come up with in order to fund the tax cuts that they are proposing.
You mean the tax cuts for the rich?
Exactly. That's exactly what I mean. There's no way they can do that without drastic cuts to all of our entitlement programs that we depend on so heavily in this country. Even the Congressional Budget Office has told them this. They know it full well, but they will not admit to it. In fact, just yesterday, I think our president said that there will be no cuts to our entitlement programs.
You and by entitlement,
Social Security, Medicaid, Medicare,
all of them.
yes.
Right. I've heard the president saying he's not going to touch Social Security, except I don't believe him.
He just said it yesterday again. He reiterated that, and he just lies all the time. There's just no way it can happen. There's not enough fat to cut out of the government to do that without affecting Social Security and Medicare. Medicaid.
All of them. Okay, well, Kay, I distracted you. Carry on then.
No, that's fine. I think, well, that was what we wanted to say on that. The second article that I found of great interest was one by John Canham Klein, who wrote Deny, Defend, Disinform. And this was an article that was published in FAIR, that's FAIR, Fairness and Accuracy in Reporting, which is a report on the media. You know, that's one of our problems, is that we can't get decent coverage for the issues that we care about. So this was one of those articles. John Canham Klein did a survey of the coverage of healthcare reporting by the Wall Street Journal, the New York Times, Washington Post, and the Kaiser Family Foundation, the KFF Health Report. And he looked at what it was that they were saying, and he found that they greatly exaggerated the improvements in healthcare, that they underplay the crisis that still remains, so that they don't acknowledge that there is still a problem. They note that in 2020, after the primary election, the KFF healthcare reports stopped doing their Medicare for All survey. They said that it was no longer relevant. So they no longer ask that question in their survey. The point of all of this being that the industry, the medical industrial industry, has a great hold over these major sources of news, and they use that power to present a picture that is not accurate. That's why he says everyone was surprised that in the wake of the shooting of the United Healthcare CEO, that there was this massive eruption of people that were upset with the healthcare system because it hasn't been coming out exactly how bad it is. And one of the things that Canham Klein says is that the reality is that with the extent to which people are underinsured, meaning that they nominally have healthcare insurance, but they still cannot afford their care. So he says, with the vast increase in the underinsured since the passage of the healthcare reform in 2010, plus the 28 or 30 million that are still uncovered, that we have more people now that cannot afford their care than we had before the Affordable Care Act was passed. And once people know that, you see the urgency for the need to pass a national single payer plan. The media's been building a image that things are getting better and we're patching it up and we're improving it, when the reality is otherwise, that we're in crisis and that many, many people are not getting the care that they need. And we need a reform that will go further and actually bring healthcare to all of the people in our country.
Well, I did read that, and that was one of the articles I could understand, I think. I noticed that even during the campaign, when Kamala Harris was running, after Biden dropped out of the campaign, they would talk about defending the ACA, and they would not refer, or if they referred, they did it very briefly, to the fact that she used to be for Medicare for All. And then during the campaign, they rarely mentioned that. And, I like to think that if she had come out for single payer Medicare for All during the campaign, she might just bloody well have won the election. But because haven't we seen a recent survey that it wasn't just inflation and the price of eggs that upset people during the campaign. They were concerned about the cost of health care or their inability to pay their health care bills. So that's a very good article because, and then, you know, everybody brags on the ACA. Well, first of all, the main success of the ACA is the Medicaid expansion. And then the other thing is, college kids who can stay on their parents' plan until age 26. And the other thing is you can't be penalized for pre-existing conditions. But most of the success of the ACA has been in the Medicaid expansion. And otherwise, you go into, you talk about the subsidies so that people can pay these private insurers money, and they're getting well off it. And a lot of people, as you say, think they're insured. They actually have insurance, but when they go to use it, they either get they have to have pre-authorization delays or actual denials or some kind of high deductible or copay prevents them from going to the doctor when they should go. So that article, I mean, we need to talk more blaming, and I have journalists in my family, but we need to remind them that they can't just depend on the ACA, which still leaves not only the people who've been bumped off Medicaid, but the millions of uninsured. Anyway, I'm babbling. Move on now. Maybe Paul's got something good to say about that. But I just can't help but be so darn mad at the Democrats that did not put Medicare for All on the platform for Kamala to run on.
I wish I could say something good, but I really don't have anything good to say about any of the situation that we're in right now. I talk to a lot of people on a daily basis, and I'm sure a lot of folks do. And the mood of the country is just so bad right now. It's actually, truthfully, it's very hard for me to even focus on one single issue that's so important, like healthcare, for instance. But it's this whole story of people voting against their own self-interests. Nobody can seem to figure that out, why it happens. I've seen so many articles written on it. People have their own ideas, but nothing conclusive as far as I can tell. I have my
Right.
own I have my own ideas about that, as do everyone else, but
Well, and as Kay says, we've kind of been duped by the mainstream media.
Yeah,
Now the one good thing, although the good thing that, just a minute, that expresses the bad news, and that was the Commonwealth report. The Commonwealth report that was from 2024, they call it Mirror, Mirror on the Wall, and that report just came right out and said how poorly we do in healthcare, where we stand against the countries around the world who pay so much less but get so much more and live longer. So we need to keep promoting that, but then stressing the solution. The solution is to adopt the model used in those other countries.
that's
And
exactly
I can
right.
tell you, DOGE is not the solution.
No, DOGE isn't solving anything. I heard the other day that if they cut out all federal employees, they would only get 5% of the way to what they want, the savings, in order to give their billionaires their tax cuts. So it's certainly not the place where we need to go. And we're now seeing, I mean, all of these government agencies, most of them are needed. They relate to health and safety. They relate to safety of nuclear items. They relate to Food and Drug Administration that's supposed to keep our food safe. And, all of those things are necessary. And the Veterans Administration, heaven knows, we have a responsibility to take care of our veterans and the rest of us. But I think that, we are led to believe that things are getting better in healthcare when they are not. And I think that people know that. And in terms of people's income, is also getting worse. And I think that was a part of what was happening during the election, is there was no acknowledgement of the very difficult times that many families are, millions and millions of families are facing, and that no one inside the two main parties was proposing any solution big enough to deal with what the problem was. So we had millions and millions of people who did not vote, and we end up with this Trump administration, which is taking us backwards as rapidly as they can. So we have to find a way to move it in the other direction and to move it forward. But a part of that is the acknowledgement that the Democrats didn't put forward the solutions that people were looking for. And we need to, that's why the public has to raise the issues. What would solve healthcare? And I think we know, we know that it's the for-profit mechanisms inside the system that are making it so expensive and make it not work, and divert the money into the pockets of the venture capitalists and private equity, and that frustrate the physicians and nurses who work inside the system, and that deny in many ways the healthcare that people need. So that's why it's important for us as a group of ordinary Americans to raise up what we believe is the solution. And it's clear that we need a national single payer system that frees healthcare from the profit motive, and that covers everyone, and that will allow us to put our energy into actually meeting the needs of people rather than in trying to deny those needs.
Hey, did you a few minutes ago say that there are less people now insured than before the Affordable Care Act was passed?
No.
You made a mention of that. What was it that you
Right.
said?
Well, when the Affordable Care Act was passed, we had about 48 million uninsured. And after it went into effect after years, that reduced to about 28 or 30 million, which is something like what we have now. Most of that, as Hariette said, was people going on to Medicaid rather than people buying, into the exchanges. But what increased was the number of people who nominally had health insurance, but still could not afford their care. Like they have a $5,000 deductible and they don't have $5,000 in the bank. So when they go into the hospital, they owe, $5,000. So they don't go into the hospital. They don't get the care that they need because of these barriers to care, the copays, deductibles, et cetera. So that what I said was the number of people who cannot afford their care and therefore go without is greater than before the Affordable Care Act. That would be uninsured plus people who have underinsurance.
Underinsurance, that's the term we usually use, isn't it? Underinsurance.
Well, I mean, that's kind of a technical term. I think it means, I think the definition of it is that you have to pay more than 10% of your income on health care, or if you're under a very low level of income, more than 5%. but it means that you can't afford the copays and deductibles, and therefore you're not getting the care.
Right, you've got a policy. If someone said, "Are you insured?" you'd say yes. However, if you ask the person, "Can you afford to go to your doctor? Can you afford to a trip to the hospital?" they would say no.
They can't do it. So that's the system that we have. And you know, it comes from this insurance company mindset in our country that has been adopted into law. That was written into the Affordable Care Act. Basically, it says that they say, and they are wrong, but they say they're going to bring down the cost of care by making people have skin in the game, putting
Skin
up
in the game.
copays and deductibles, because their diagnosis is that people are overusing the system. They are
Right.
wrong.
Right. And of course, you and I have talked about skin in the game before. It's such an ugly term. But I, belong to the League of Women Voters. And even in one of our policy documents, they've since changed it. But one of the earlier documents actually did say they believed in cost sharing. And that's what skin in the game is. It means that the patient has to pay something. Well, if paying something keeps you from getting care, then that's just a bogus idea, in my opinion.
It's a barrier to people getting care. Well, the reality is that there are many, many more undercare than there is overcare. Now, I'm sure there is some, where things are prescribed or that aren't really needed, but that's minimal compared to the amount of undercare, which is people who need care and are not getting it. And, we see that all the time with people who are diagnosed with cancer, and then the chemotherapy that is prescribed is so expensive they can't afford it. That's what happened to the woman from Louisville whose husband was sent to MD Anderson, and then the insurance company denied payment, and MD Anderson in Texas says you have to have the money or you don't get the care. Can you imagine?
And I just read something about, during his big speech the other night, his speech to Congress, President Trump introduced a little boy who had cancer and was being treated, or had cancer and was being treated for cancer. And then the news came out somewhere saying, today I read, that the research that is, would help him help cure that particular cancer has just been stopped by DOGE and the cuts, And what did I've got a few other DOGE things that just kind of came out today, that the Reuters says the Department of Veterans Affairs will begin mass layoffs as early as June. And it's just, part of Trump's campaign to cut federal government agencies. Well, I mean, we really respect the VA. In fact, the VA is the closest to single payer. But anyway, so they've upended the Department of Veterans Affairs, delayed cancer trials, and then Trump has even cut grants to Columbia University because they had student protests. And that school, apparently, I didn't know this, gets most of the National Institute of Health grants, the NIH grants. And then fired the CDC worker who was fired, and when he or she, I think it was, who was a cancer researcher, was fired. But then she was asked to come back and she just said, no, thanks. And then even the New York Times finally did say chaos at the VA, and that was today. And I'm sure you all, I mean, I've got this whole long list I printed up of the dismissals by agency. How many, like we know about USAID, AID was the overseas aid. They're going to cut 10,000 people, approximate number of employees being laid off, 10,000. And I mean, that's at home and abroad, I guess. And even the CIA is going to lay off 50. And one shocking one I know you won't like, Kay, because you're a union person. DHS, what's that? Homeland Security, DHS.
So,
They're stripping the union rights from 47,000 TSA workers. Those are the people that examine your bags at the airport.
right,
And well, and that HHS, that's what's his name? Kennedy Jr.'s, Robert Kennedy Jr.'s department, HHS, is offering buyouts to 80,000 workers. I mean, just who's managing all of that? You just really wonder. I'm going to shut up for a while and let you and Paul talk. I have this great long list, though. I can read off some other agencies that are being harmed.
Well, I've dug up a few facts on the threat or the ramifications of the cuts by DOGE on healthcare in general.
Good.
And millions could lose health insurance, with estimates suggesting up to 20 million people might be affected. That's why I asked you, Kay, to reiterate what you said earlier. 20 million people. That's a big chunk of the ones that are currently using or benefiting from ACA. Medicaid expansion could be reversed, stripping coverage from many low-income Americans in 40 states. Work requirements for Medicaid might be imposed, creating barriers that could disqualify millions of eligible individuals.
What did you say could be that? What was the first word you said in that last group? Something could be closed, something could be cut. What I didn't hear what you said.
Medicaid expansion could be reversed, stripping
Right,
coverage for many low-income Americans in 40 states.
right. But then right after that, you said,
Work requirements for Medicaid might be
oh, work
imposed.
requirements. Right. Okay. Thank you. Yeah, I hate those. Go on.
Medicare and Medicaid services may face disruptions affecting tens of millions of Americans who rely on these programs. I mean, the people that get to keep their Medicaid are going to suffer greatly because of staff shortages and the hospitals that may close because of it. It's
Oh,
just there's some
particularly rural hospitals. Right. In
exactly.
Kentucky. Yeah, go on.
And the billions of dollars that to cut scientific research. You mentioned that about cancer treatment research. Uh, that could be a loss of 6.1 billion dollars in our GDP and 46,000 jobs nationwide.
My
You have
God.
clinical trials that may be delayed or abandoned, slowing the development of new treatments, particularly in cancer research. And then you think about the brain drain effect that could discourage the next generation of scientists from pursuing careers in the public sector. I mean, this is part and parcel to what the whole country is dealing with right now. What kind of future do we have? It's uncertain. It changes on a daily basis. So we get now to public health and safety, which is affects everybody's health. Food safety, medical device safety, infectious disease research, they all could be compromised due to staff reductions. Well, will be compromised, I guess I should say. And the nation's preparedness for emerging public health threats may be diminished. Maternal health outcomes and efforts to low health costs could be negatively impacted. And then we get to the simple economic impact of all this. Labor income could be reduced by $4.6 billion due to job losses in research and related industries. States may be forced to cut education budgets and reduce infrastructure investments to absorb increased healthcare costs. Support for veterans programs may be reduced with some expired health programs for veterans at risk of cuts.
I mean,
Children's health. Go ahead.
No, I'm just said, oh my gosh, I mean, that's just terrible. Go on about children.
Proposed cuts could result in a loss of $100 billion in critical investments for children's health programs. These potential ramifications highlight the complex and interconnected nature of healthcare spending and its impact on public health, scientific progress, and the economy. The proposed cuts by DOGE could have long-lasting effects on the healthcare system and the overall well-being of Americans. And I think every day, more and more people, including MAGA people, are starting to realize this, and that's the good news.
Right. Unfortunately, it'll take a little while for all those MAGA voters to realize what they've done. Um, and the one thing, all the workers that are losing their jobs, that means they'll pay less in taxes. There'll be a cut in taxes. And so like even Kentucky that thinks it's got a surplus in taxes right now is certainly going to be losing some money. And now our state legislature that is GOP dominated wants to wants to implement DOGE in Kentucky. I mean, you just want to say, you want to hit yourself on the side of the head and say, how can you possibly be so duped by Donald Trump and Project 2025? I mean, we really should have known it was coming. We just, we just didn't realize that
Well,
people.
it's ever so important that from the grassroots of the nation, that there be a call for the reforms that would actually solve the crisis. I mean, that is what is absolutely key. There was nothing from the two major parties in the election that gave any indication that either party was on top of the depth of the crisis. And that's why, we organized for a national single payer healthcare plan. You need something that will acknowledge the depth of the crisis and the cause of the crisis. We are on a path now with the Affordable Care Act that is trying to move everything into value-based care. Value-based care doesn't help. It's a privatization scheme. It's simply pretending to pay for value rather than for volume as it quickly privatizes all of Medicare that we have now. Back to our beginning, when Brad Smith at the Committee for Medicare and Medicaid Innovation, his scheme was to put all of people in Medicare in a city, in a geographical area, into a direct contracting plan where they would be under the thumb of a private venture capital or private equity entity, basically doing away with traditional Medicare. That was his scheme. Now, Brad Smith is operating in DOGE on a national level to be cutting healthcare. So what will he put into place? We don't know, but we have to believe that there is a latent power within our nation of people who believe in democracy and who believe in decency and in healthcare for everyone. And that's what we work to stimulate, is the rising of that demand that would change what is possible in the nation and allow us to enact a national single-payer healthcare plan that would remove the for-profit entities from our healthcare and allow all of us to get care and allow our physicians to practice free from insurance company interference in what they can diagnose and what they can treat and what they can do. We're looking for freedom. Freedom for physicians to practice, freedom for patients to get the care that they need, and a healthcare system that frees us from corporate profit. That's what Kentuckians for Single Payer Healthcare is working for. And we encourage everyone to join with us in making that demand bolder and braver and bigger until we actually make the country go to the system that it needs.
I think, uh, go ahead.
Well, I was just going to say, I understand for the layperson, Medicare and Medicaid and all of all the shenanigans going on in our system is complex and hard to understand. And the nice thing about single payer is it's just very clear. Everybody has a card. Everybody is covered from the time they're born till they die. You go to the doctor, cares for you, submits the bill to the government, and the government pays the bill. And everybody participates and everybody benefits. And it's so much simpler than this hocus pocus boondoggle we're in right now.
Well, that sounds really good, Harry, and I think you're right. But I have a question. How are we going to pay for it?
Well, originally I'm Canadian, and right now I'm not sure I want to raise that issue because the Canadians are fighting to protect their economy from other Trump activity. But the Canadians participate. Everyone pays a little bit, and nobody pays a lot. And you cover your neighbors when they need it, and they cover you when you need it. It's just, well, it's the way we pay. I hate to mention the Pentagon or our transportation services or our fire departments. And people understand that everybody benefits. So, but I'm glad you asked that question because that's the question people ask us all the time.
And the truth is that we're paying for it double and we're not getting it. That's the truth. That's what people don't know. And that's what is never revealed, by the mainstream media or by anyone, that the reality is that in our nation, we spend double per person on healthcare what the other industrialized wealthy nations spend. And yet our outcomes are far below theirs in terms of life expectancy and maternal mortality and infant mortality. We're paying double and we're not getting good care. And what we have to do is remove the for-profit entities that cause that extra expense and use that money that went for profit and excess administrative costs, put that money into care. So people will pay less rather than more. And that's the story. We have to change the system rather than continue to pay too much and get too little.
Well, I don't want to use up all our time, but we did talk about Medicaid in Kentucky, and close to 30%, 28 to 30% of the Kentucky population is covered by Medicaid or CHIP. CHIP is for the children. And it's interesting here, there are uninsured rates in Kentucky. Well, no, I don't want it. Right now, apparently, before the ACA, there were 17% uninsured in Kentucky. Now we have 7% uninsured in Kentucky.
Mm-hmm.
And that and that ostensibly lower percentage is due to Medicaid. Medicaid is covering,
most of it's Medicaid. Although I think that we have to say that Medicaid, as much as we celebrate that at least, millions of people got some form of coverage, It's a very low level of coverage. Those are privatized companies running the show. People have a lot of difficulty in staying on those programs. They have to keep re-signing up for them and proving their eligibility. If you get a job that pays a little bit more, you may get kicked off, and you are on a lower level of payment to your doctor and to your hospital if you're on Medicaid. And it's an ugly way of saying to low-income people that your care isn't worth as much as the care of other people. Because what that does, it makes it difficult for those people on Medicaid to find specialists who can take them. It makes it difficult for our hospitals to survive on the low rates of payment that they get from Medicaid. It's a lower tier system. We need to do away with the tiers. We need to be all in the same level of care, good quality care for all of us, one single system that gives all of us what we need, whatever medical care that we need, not a lower level for the disabled and the low-income people. It's a horrible thing. They pay so little that a physician practice can't survive if they only have Medicaid patients, because
Well, and a lot of doctors won't take Medicaid patients.
that's true. I mean, but what
Terrible.
the reason is because of the low level of reimbursement. So there shouldn't be a lower level of reimbursement.
Because you're
Everyone
poor. Yeah.
be
Right.
in one level of care, good care for everybody, and we'll be a healthier, happier nation. We shouldn't have people having to beg to get care. I mean, this is stress, and this is an ugly system that the nation has come up with, and we need to put it aside and say we're going to have a better one, that we are a better nation than this. We are better people than to leave our people without the kind of care that they need. And
Right. We must appeal to Americans to act on their best selves and
yeah.
to support health care for everybody. The other thing about Medicaid, people forget how many seniors in Kentucky who are in senior facilities, how many of them are paid they're covered by
That's
Medicaid.
true. Most people who are in long-term care and nursing homes are in the Medicaid system and dependent on that. And heaven forbid that we lose that. What would we do for the millions of people who are in that system? And
Right.
yet we know we need to do better. We know that those nursing homes are understaffed. We know that in many of them, the care is not a high quality. So we have a lot to do to make it better. And I think that's possible, to unite people around making it better. And perhaps out of this crisis, we can find the energy to move the nation forward, to say we're not going to put up with this. We're not going to be treated like seventh class citizens by a government in the hands of a billionaire with a chainsaw. That we have to make a demand that the nation respond to the needs of the people.
Yeah, it's as far as nursing homes go, it's people are literally going to die as a result of this. Thousands of people are going to die. How can an administration be so heartless and cruel? It's just people like us cannot comprehend that. And I can't believe that the American people really truly back that. And hopefully, like I said, every day people are starting to realize that, hey, something is going wrong here with Trump too and DOGE. And so we have hope that it can change. And in a couple of years, when the election cycle comes around, and we can actually get control back of Congress and do some good work.
Well, the sad thing is that Congress doesn't seem to do its work. they seem to have forgotten that they took an oath to defend the Constitution and to um, curtail the overreach by the executive branch, which is what we're facing right now. Now, I did go to a town hall for one of our local congressmen, and there was only one negative statement, and I'm sure there are MAGA supporters who believe this, and that is, well, we can't keep spending more than we have. We have to try and aim for a balanced budget. But they're trying to do it overnight. And we may all agree with that we should be pushing towards a balanced budget. But you can't just, as Kay already mentioned, and Elon Musk is taking a chainsaw to our budget. I mean, there are places where probably fraud is going on, but apparently even DOGE hasn't found any fraud. They've found a little bit of maybe some careless bookkeeping, perhaps, but they're not finding fraud. And I mean, it's unbelievable. And of course, what you think is important and what Elon Musk and Trump think are important might not be the same things. Well, Paul, you're better at the budget stuff than I am.
Well, yeah, I guess it's time for my plug on modern monetary theory. That if we need to spend money, if Congress needs to appropriate money and have the currency issued by our government, then we do it. I mean, that was no better exemplified by how we handled COVID. We needed $1 trillion and we found it and spent it. And we can do the same. We could do the same thing for healthcare, Medicare for all. I got a hand signal there, Harry. What was that about?
Oh, well, I thought I held up 4 fingers.
$4 trillion? Is that what we spent?
No, 4 fingers for 4 minutes left.
It's
We're not very tech savvy here when it comes to timing. We need to set our own timers when we first start to talk.
It's over 4 trillion that they're looking to cut out of the budget in order to be able to continue those tax cuts for the very wealthy people. And most of the tax cuts go to the billionaires and the super millionaires who don't need it. And it's not a cut for the rest of us.
Well,
I just want everybody to realize that these things we're talking about, healthcare, Medicare for all, defense, homelessness or houselessness, those are all policy decisions that we hire people to go to Washington and make for us. And it's for the people, of the people, and they're making all the wrong policy moves right now. Never in the history of our country have so many wrong policy moves been enacted. So
I think
my message is let's not despair and certainly not quit looking at the news, but let's, like we talked about earlier, get away from mainstream media. We're not going to get the picture. Tune into radio programs like this. Go to the internet and look for news channels that are forming every single day on YouTube. We have people that are quitting major media places and starting their own YouTube news network so they can report the things that are important. And they're not governed by the big money that tells them what they can and cannot say on the air.
right. Look at the facts, not just Fox News. But I do think you can't hole up in a burrow. I think you do have to send that letter to the editor or call your congressperson and make your complaints known. And I mean, there was just something in the paper, an op-ed piece in the Courier yesterday, where one of our state senators, Keturah Herron, I think her last name is, and she not only complained about what was going on in Louisville, but she made good suggestions for change. And I think we should all be doing that. Needless to say, I'm not afraid to speak out. Sometimes I do babble on.
Well, we need an upsurge of citizen action and protest and anger and involvement in making these voices heard so that the best of our country can come forward and we can begin to get the solutions like we need, like a national single-payer healthcare system that would cover all of us for all medically necessary care, and that would be with us from birth until death, and that would make us all equal, and we would all fight for it to preserve it and make it work for everyone. Thank you for listening to Single Payer Radio, and we hope you'll join us again.
Right, and we'd love to hear from you.
You can find us at www.kyhealthcare.org.
Thanks again for tuning in, and thanks to Harriet and Kay for providing us with today's program content. Tune in again next time for Single Payer Radio, and have a wonderful rest of your day.